Um, okay, so for the COVID-19 community update, I think the first of the year, and so our big news for the Department of Health is that we have a new Secretary of Health. Dr. Grace went back to being Secretary of just one department, which is HSD. And joining us is Patrick Allen from, I always get this wrong, from Oregon. And so that is exciting. He did a lot of work on their COVID response. And so yeah, still getting to know him. I was away for the first week of January, so I still feel like I'm kind of catching up. All right, so on COVID-19 news, overall in New Mexico, things are looking better. I think mid-December, this COVID community levels map was not looking that great. Now we're almost all in the green. And this really reflects, again, hospitalizations from COVID. And then, as we know, what we continue to deal with in New Mexico, although it is also getting better, is just that a lot of the hospitalizations weren't just from COVID this winter, but also from flu and RSV. So while the COVID alone map didn't necessarily look terrible, the hospitals were really strained with the burden of dealing with flu, RSV, and COVID, kind of all the combined respiratory viruses. So the community transmission map, and again, this is just looking at COVID cases and the percent positivity, also a much bigger mixed bag in New Mexico. It has been just red, and now we're starting to see other happier colors join the map. So that is all good news. But in the back of our heads, we have to keep in mind that there is kind of, as each month goes by, less PCR testing that happens really across the US. But especially in New Mexico, it's, as I think we talked about on this call, curative wrapped up testing operations for their whole company, so here and everywhere else. And that was about 15 to 20% given the week of our PCR testing in the state. So people are still doing a lot of testing, but more and more it's become home rapid testing. But still, this is all good news. If you look at the community, this is just the cases by week, and you can see that we're really on a downward trend here since that, early in December. So that is great news. Now, on the kind of in the big unknowns category is what's going on with the variants. We had the BQ1 and BQ1.1, which probably drove our last little hump, and which, I don't think we really need to call them surges anymore, because while lots of people do get sick, we aren't seeing the same hospitalization rate from new variants, and that's largely because people have a lot of immunity either through past infection or from immunization. Excuse me, I have kind of a bad cough. Okay, so the new player is XBB, and we've been hearing about this one for a while. And in the whole XBB group, there's sort of a special variant XBB 1.5 that is emerging as a fairly aggressive variant. It has mutations that make it very transmissible. There's no evidence that it's making people sicker than the other variants. And it probably does, just like every previous variant, have the ability to kind of escape our, escape immunity a little bit. But again, what's holding up well is that the immunity we have from immunizations and prior infection does tend to prevent the hospitalizations and deaths, but doesn't stop people necessarily from getting it. So XBB has been identified in New Mexico. It doesn't seem to be making cases rise. It's also a little hard to tell, like, kind of how much of our variant mix right now is XBB 1.5. But across the US, it's definitely kind of taking over from the BQ family. So let's see, I think we covered most of this, which is it is still possible to get XBB 1.5, even if you've had other Omicron variants. Um, and again, the one thing we covered most of this, the latest Omicron booster, as well as medications like Paxlovid are still expected to help. And I think that is a really important point, that Paxlovid and Molnupiravir, so those are the two oral medications, aren't as likely to be they will continue to work because of how they're created and kind of what they target. They should continue to work even as we see new variants. The monoclonal antibodies were very specific to to kind of the structure of the variant that they were targeting. And so as we've seen, as new variants come along and kind of the more different the variant gets, those monoclonal antibodies stopped working. But fortunately, Paxlovid and Molnupiravir continue to work even in the setting of new variants. The other thing that we isn't new news, but just a reminder that really kids 6 months and older can now get an Omicron vaccine. And our coverage rates in New Mexico, they're definitely lower than we'd like to see them. But probably the key thing here is that 65 and older group, the most vulnerable, because again, age just remains the single biggest risk factor for bad outcomes from COVID. So in 65 and over, we have almost a 45% of the population who's eligible for the bivalent booster, which means you have to have had a primary series, has had that booster. But I would keep pushing on this group to get that to get boosted, because they're the group that's likely to reap the most benefit. But really, everyone should get the bivalent booster. And you can see that the rates are incredibly low as the ages go down. But, in this 18 and over group, there's lots of people here where they have chronic diseases, or, they're 50 and over. And that group is very vulnerable as well. So we'd really like to see that bivalent booster rate get higher. So the COVID-19 vaccine misinformation continues to be an issue. When this very dramatic event happened at the NFL game, and Damir Hamlin suffered a cardiac arrest, immediately with really no basis, people started talking about, was this the COVID vaccine? And, I don't know that they've disclosed when his latest COVID vaccine is, but I think it's pretty clear that that is not what caused his cardiac arrest. Okay, turning to influenza, which has been the other huge player this winter. The map across the US is looking a lot better. And, I think one of the questions we had, what we saw was a very early flu surge across the US, but especially in New Mexico. And a question was this going to be a really prolonged surge, or was it just going to be an early surge? And at least right now, it looks like, it was fairly prolonged, but it's mostly early. It is headed down, so we're not going to deal with super high flu rates all winter long. New Mexico, though, you can see remains one of the darkest colors on this map. So definitely we started early and are tapering off a little bit slower than some other states. This is New Mexico specific data. The big fat yellow line here is our curve of influenza-like illness. So this is actually kind of a combined measure of this. This isn't necessarily people that tested positive for flu, but people who showed up at their doctor with a fever of 100 or higher and a sore throat or a cough. And so that could be from RSV, it could be from flu, it could be from COVID, it could be from a bunch of other viruses that we don't know. But overall, it's a pretty good indicator of respiratory virus activity. And you can see we went way higher than in past winters, but we are on the downward trend. So that is good news. Okay, and then monkeypox, which yay, continues even though we've had a couple of holidays, and there's always worry that with holidays there's more kind of interaction and potential for disease spread. But we haven't seen that with monkeypox. In the state, we've been pretty stable at 57 cases. So every once in a while we get a new one. And across the US, we're seeing the same thing, really a downward trend. So again, lots of people that got vaccinated and lots of people that made different decisions about sexual interactions. So hopefully that is, we won't see another spike there. We do continue to publish our monkeypox weekly report, but it doesn't change much week to week. So that will probably move to monthly fairly soon. And that is all I have today. So thank you so much. I'm going to close those slides out and turn my camera back on.
So one question in the chat is, if a person gets none of the monovalent series of COVID vaccines, but gets the booster, is this adequate for protection? And is it recommended that those who didn't originally get vaccinated just get the bivalent booster?
So let's see, if a person gets none of the monovalent series of COVID vaccine, but gets the booster, is this adequate protection? So that really shouldn't happen, although I'm sure it has, because the number of vaccines people are dealing with has gotten so much bigger. So, we're definitely seeing an uptick in vaccine errors, most of which, don't, it's not good to have vaccine errors, but most of which CDC kind of says, oh, well, if you got a monovalent booster dose as a primary series, they don't tell you you have to repeat the monovalent. So it shouldn't happen. The only way you should be able to get a bivalent booster is if you've had that monovalent series first. But the other thing I would say about adequate protection is really what we've seen is that one dose does help protect against COVID. 2 doses definitely helps more, and 3 doses helps more. So probably, I don't know for sure, but in the future, I do wonder if we'll have more of a actually, I'm going to just walk that back. I have no idea what the future of COVID vaccines is going to look like, because it is so, it's just hard to know what direction with so many new variants coming out. But yeah, so I would encourage someone who's had only 1 dose, whatever that is, to get a second dose at least.
Marisa, do you want to ask your question?
Yeah, so we are close to Casa de Peregrinos in Campo, and they are receiving a lot of immigrants that come and ask for services, and they also come to our clinic to get vaccinated. So we've been having the concern of some of these immigrants have their vaccine already, which is Sinovac, and the other one we've seen, I think it's AstraZeneca or something like that. Do we have to restart them, or do we just go ahead and give them their Omicron? We just give them the Omicron?
Great question. Yeah, it used to be way back, a lot of them had to get restarted, but now it basically, in general, the recommendation is just kind of pick up where they left off. So if they've completed a series of AstraZeneca, same rules apply. It should be 2 months since their most recent dose. But as long as 2 months have gone by since they finished that AstraZeneca series, go ahead and give them the bivalent booster.
Okay, great. Thank you.
Yeah.
Thank you. Rosalba, do you want to ask your question?
Well, we're doing vaccine clinics, and I guess the people that put the vaccines, they go through the training on how they're supposed to apply them and all that stuff. And what they're doing is, because we did find a couple of people, 4 people they had none of the vaccines, and what they did is they gave them the first dose, and they told them they had to come for the second, and then they could get the Omicron. So that's what we're seeing in the field, that's what the vaccinators or the people that apply the vaccines are doing.
Yeah, that is correct information. If you've had no COVID vaccine, you have to start with the original or monovalent vaccine. And the only way you can get the bivalent booster is if you've had a completed series. So when we had Johnson & Johnson as an option, 1 dose of Johnson & Johnson or 2 doses of Moderna or 2 doses of Pfizer. And that may change. VRBPAC is meeting at the end of January. And I think one of the things that they're looking at is just like, it's such a complicated situation right now with so many vaccine options. Like, is there a way to simplify it? But we don't know that they're going to make that decision. So it's possible that at some point, just the bivalent will get used for everything. But for right now, you still have to get that original vaccine series and then get the bivalent booster.
Fabiola?
Thank you. Hi, Dr. Miranda. Is there any review in the efficiency of the vaccines towards having all of them, or the 2 first and the Omicron? Is there new studies about that?
So that's a great question. One of the difficult things about really studying the effectiveness of the bivalent booster is that as soon as they approved the bivalent booster, they said you can't use the original vaccine as a booster dose. So there's no like really head-to-head comparisons. But there was one study that came pretty close to looking at people who got the original vaccine as a booster pretty late in the game, right around just before the bivalent got approved. And from that study, and I can send you, it was in an MMWR, they estimated it's probably in the older age group about 30% more effective to get a bivalent booster than a regular booster. And it was a little bit lower, I think more like 21 or 22, maybe in the lower age group. So about 20 to 30% more effective to get a bivalent than to get a regular booster. Or regular, I should say, the original booster. Yeah. Is that your question? Okay.
I have one more concern.
Sure.
So what is everybody doing in regards to those people that don't have their vaccine cards and they don't have verification of their past vaccines? They state that they've had a booster already and that they need their Omicron, but we don't have proof. Do we go by what they tell us, or is it important, if we don't know their vaccine status, to either restart them, or what do you do in that case?
And are you speaking kind of more specifically about people coming from another country, so you can't?
And in just other states in regular, we have a lot of people like from El Paso, and they come to get their Omicron, and our clinic or MA does not feel comfortable vaccinating them unless they have proof, which I find unfair, because it's like, we're here, we're giving out the services. They're here for their Omicron, but they lost their vaccine card. We don't have any records of their vaccine history. So what we've been doing is we tell them for them to call El Paso or call wherever they got where they received their vaccine, and once they have the proof that they could come to us and that we could give them the vaccine. I was just wondering, like, what is everybody else doing when it comes to that situation of having no history of their vaccine and them wanting the Omicron, but us not knowing where they're really at.
I mean, I'll say, I know there's lots of, there isn't really a rule about this, and there's not one right answer. So I think medical facilities do need to kind of, to some extent, work this out for themselves. But I will say, I mean, and I'm happy to look for kind of more official CDC guidance on the question of like immune compromised. CDC was very clear on that. Patients can self-attest to being immune compromised. You don't have to present proof. And so kind of taking that as a model, I feel like overall, I guess I would err on the side of believing people. I mean, I think about myself, if I didn't have my card and I went for my Omicron booster, like I would want someone to believe that like I know that I've had a full series. I think as medical professionals, we tend to sort of, like discount people's understanding of the process. But this one, I think people are tracking pretty carefully. I think if I had someone who was maybe sounding kind of confused about it and I wasn't sure that it was like medically responsible, that you might say, hey, let's work a little harder to track down your vaccines. Yeah, I guess I would lean towards, overall believing that people know that they've had a complete series and they haven't had the Omicron. And, there will be times when we're wrong, but overall, I don't think there's a lot of harm done with an extra vaccination.
Great, perfect. Thanks.
And I should probably say that's not necessarily official DOH guidance, although I think overall DOH does want to see people have access to vaccines.
Thank you very much.
Yeah.
Thank you. Maria,
and
do you
I want to agree with the comment here. If it is New Mexico, I mean, there are lots of ways, not always easy and fast, but there are lots of ways to kind of track down that information and get people a record that they can keep.
Yeah, adding to that one, Ms. Miranda, Dr. Miranda, what we do is we do tell them to go to the Department of Health and get their shot records. Just because we have a couple of occasions that the people do not really know which vaccine they have or how many they have. And when they bring their cards, sometimes they even already have the fifth one, the bivalent, and they still wanted another one. So we collaborate with the Clínica de Familia, and the nurses there, they really try to help out, but they really want to be sure they're giving them the right shot that they need, because people do forget. Sometimes they only have one and they say, no, I already have the third one. And when they check their record, it comes out, okay. And if it's New Mexico, we just tell them, go to the Department of Health. They'll give you your health, your record there, even in Texas. And sometimes they have New Mexico shots and Texas, and we tell them that they don't combine the same information. So La Clínica de Familia is really, really on top of that to be able to have the correct information for that patient.
Yeah, and I mean, I think that is ideal if you do have a route for getting vaccine. And I guess, maybe for someone coming from Mexico, it's not really doable, or even some places in Texas, it might be difficult. So I guess I wouldn't make it an absolute, like you have to have this information to give the vaccine. But but I think it is great. I mean, it's also really helpful for any individual to have that record. And if they've lost it, like helping them to get it back, I think is really
And we
important.
even tell them, as soon as you get your shot, please take a picture of your card and you'll have it there. Even if you don't have your card, you'll have proof of what you have gotten. So many, we do recommend for them to take a picture with their phone.
Yeah, then I learned you have to make it your favorite because otherwise it is buried. I was like, you know, somewhere I went required a vaccine card. And I mean, that was like, this is before the bivalent, but it was months ago that I got my last one. So I'm scrolling through, you know, just snow pictures and landscape and dogs and children. And then I'm like, finally here it is. So anyway, that's my tip. Also, I do want to say that Maureen put in VaxView, again, a little bit of a glitchy system, but if it works, it's amazing. And I did finally get my record. So now it's like, if you have an app like Apple Wallet, it's there and I don't have to scroll through all the pictures. So that's another great, it doesn't work for everyone. And the more complicated your last name is, the less likely to work. But if you have kind of a straightforward name and haven't changed your cell phone in a while, it works great.
Fabiola?
Yes, continuing with this conversation about the cards. And in Texas, and especially in El Paso, we were in Texas and in Mexico with the vaccines. And yeah, it was a very chaotic starting of the vaccine. And so a lot of people, they have different places taking the card. And a lot of them, especially in the civic center, it was a mess. So we always refer them to the Department of Health also in Texas, and I can send the link to Marisa so you can check. And it doesn't take a lot of time, so you can check them if they are vaccinated in Texas and Mexico, because yeah, in this area, the borderland, we need to be aware of working with both departments because people moves in and out of the both states. So we can share that information with Amador or whoever needs it, no problem.
All right, thank you. And lots of other good tips here for how to not lose your Vax card in your photos and on your phone. Thank you, everyone.
Rosalba?
I just want to mention that I got my first big vaccines in Texas and the later ones here in New Mexico, and they found me because so I thought it's not like a state registry, isn't it like a national registry? Because they found me.
So that is a good point. It had been just a state registry, the New Mexico Immunization Information System, the NMSIS. But through the pandemic, one of the things the vaccine team worked on was linking to other states. So there would be, especially, you know, in bordering states where kids, you know, in the western part of our state, a lot of people from the Navajo Nation will go to places in, you know, back and forth between New Mexico and Arizona for childhood immunizations, say. So, and then, you know, the people who live in Farmington sometimes get care in Colorado. So like, you know, all around our state, there's people going back and forth across borders. So a lot of work was done on this. However, the sharing of information had to go two ways. And so not all states were as interested in, I mean, I shouldn't say they weren't interested, but like it does take work to work on it. Not all of them had the bandwidth to do it. So I haven't checked in a while, and I can do it and just let you know next time which states we are. I think Nevada sticks in my head, which is probably not the most useful one, but you know, there are a few states where we have that back and forth sharing of immunizations. With Texas, it's also complicated because they have multiple departments of health. But at one time, kind of mid-pandemic, we got a huge data dump from Texas, and that helped, you know, and not obviously not all the Texas records, but anyone with a New Mexico address who had gotten vaccinated in Texas. So yes, sometimes we do have across state information, and I think the push is to try to have that, you know, it'd be awesome if we had a US-wide immunization registry. It would probably save kids an awful lot of vaccines. So, so let me find out a little bit more. All the IHS sites, Indian Health Service, almost all of them now report into the immunization registry, which was not a requirement, but through the pandemic has done it. And even the VA that has never reported into the immunization registry now is starting to in New Mexico. Their historical data is not available, but anyway, so progress is being made.
Thank
And
you.
that's maybe why you were found, Rosalba.
Still a work in progress.
Still a work in progress.
We still have a couple more questions in the chat, so I'm going to circle back. One of them is, does the NMDOH keep a list of clinics or other organizations like Walgreens that provide COVID vaccinations on a regular or scheduled basis? And do these agencies also provide the monovalent vaccinations?
I think so. Do we keep a list? Probably the best source is the vaccine app, and that's really only people who are scheduling in the vaccine in the registration app. So not a comprehensive list. Pretty much every large pharmacy chain is still vaccinating, and they, you know, there may be a day when a certain Walgreens doesn't have the monovalent, but at this point, everyone has stashes of, you know, of the monovalent vaccine. It may become a little, it's probably going to get harder and harder as there's less and less demand. I think large batches of vaccine are expiring at the beginning, you know, at the end of January, beginning of this year. And then we might see providers decide not to reorder. And I think that will be, that might make it harder to get a primary series. Excuse me. So, but then, like I said, this meeting is happening where I think there's some thought that maybe they will switch away from requiring the original vaccine, the monovalent vaccine, as your primary series. So I would say next meeting, hopefully we'll have a little clearer picture of what the future looks like on that front.
And may I, in this last link that I post in the chat, you can find accordingly with the zip code, pharmacies that have the vaccine available, and then you can see in each of them which vaccine they have and which not, and then you can schedule, and it's nationwide.
Great, thank you.
Thank you, Fabiola.
That is a great resource.
Another question is, are there any updates on when funding runs out and how uninsured individuals can still have access to vaccines, home tests, PCR testing, and treatment?
That is another good question. So no, I don't have any updates. For vaccine, for most of these things, what the CDC seems to be saying is like when we run out, then they're not going to purchase, the federal government's not going to purchase more. And so there won't be funding. Or then places will have to buy their own vaccine and then they're going to charge for that vaccine. So we know that the health emergency did get extended through mid-April. And I'm guessing that that will, you know, that probably we're good through mid-April. Let's see, home tests, the federal government did, so home tests kind of get funded separately, but in New Mexico, we are continuing to support that Project ACT. They extended through through the end of June. Their program is going to continue, and then we bought more tests to be able to, you know, so people could still order. So that isn't federal funding, but will continue to be a resource. And then I think things like being able to get free tests, home tests on your insurance, like having insurance reimbursed or having Medicaid cover them, is probably going to be up, you know, we'll go through the public, as long as the public health emergency is extended. And then I think we don't know what will happen at that point. For kid vaccines, they will be covered under VFC. So in New Mexico, any uninsured children will be able to get vaccinated, just like all their childhood vaccines under the VFC program. So that's most or many providers in New Mexico who give kids vaccines are VFC providers. And then for adults, there's not a similar adult vaccine program, although there is a proposal at Congress to create one. So that would be lovely, but seems unlikely to get passed. In New Mexico, there's usually a little bit of state funding to buy vaccines for uninsured adults. And then those are available through the public health office. And it's not every single adult vaccine, but flu, pneumovax, and COVID should be included in that as well. I don't know if I covered it all. PCR testing is just kind of like Medicaid continues to cover PCR testing, but just fewer and fewer people are doing PCR testing.
Thank you. Does anybody else have any other questions? There's some love for you in the chat, Dr. Durham.
Thank you. It's nice to see you all. It feels like it's been a long break from this call. So thanks to all of you. And if there aren't any other questions, I might drop off.
I think Rosalba has one more thing.
Okay, yeah.
Rosalba?
See, I'm sorry, I couldn't get the icon. Before, in the beginning, they were saying that the COVID vaccine was going to be like the influenza vaccine, that it would be that you would have to take it every year. Is this still true or no? Unless it mutates, or do you have any information on that?
You know, I don't. I think when that bivalent booster came out, it came out like around the time of the flu, there was lots of talk about that. I agree. And again, maybe this will be one of the topics that they cover at the vaccine meeting at the end of January. But, and I was just talking with someone about this, that it just seems a little bit unclear, because I think one of the things that is clear is that people's immunity wanes. Like you get your booster, whatever booster that is, and you're like all boosted up for about 4 months, and then it pretty rapidly wanes. And again, your body does remember some. I don't want to say it wanes to 0, but it's clear that, you know, it kind of wears off. Now, the flu shot does the same thing. When you get your flu shot at the beginning of the season, you have a much higher antibody level, and then by about April, May, you don't have that much immunity. But fortunately, flu doesn't usually stick around in April and May. Like it really just comes in somewhere around October to December, and it leaves, by May. So that's okay that we have waning immunity, and then you get your next flu shot the next winter. So I think there was kind of hope that that is the pattern that COVID would have. But as you can see from that, that variant chart, it's not that clear. Like we had our kind of winter variant we thought was the BQ1 and BQ1.1. Now we have XBB. Like, is there going to be another one, or once it gets to be warm weather, are we done with COVID for a while? So I think those are all questions. Like, to me, there's not a clear pattern that we only see new variants or, large amounts of COVID in the winter. So I think until we see that pattern, we won't know for sure about the vaccine. I think it's a really interesting question, though. So more to come.
Thanks for being here, Dr. Durham.
Yeah.
Thank you all for your questions and your hard work week after week.
Yeah, great questions. All right, I'll see you in 2 weeks.